I am a mother of two beautiful children. My older one is 11-year-old and he is a special need child. When he turned 7.5-year-old, then we had his evaluation finally done from Children's Nation and we came to know he comes under a spectrum. Very hard for us to accept at that time. We didn't know what to do at that time. It took us 1 or 2 days to come out from there that he has autism. Somehow we managed. We just tried to control our emotions. Fortunately, last year we came to know that Dr. Sharma is coming from NeuroGen for his seminar. As soon as his dad came to know that he's coming, let's go and meet him. He listened to him. He was very satisfied and he said, I got all the questions, whatever I asked. Maybe I started having a big hope this time. We decided, let's go to NeuroGen. Let's go for it. We had his first round of stem cells. Within a month, he said to me, Mama. As a mom, this is the biggest part for me. Mama word. When he went to bed, he said, good night, Mama. And the only person who came to my mind, it was Dr. Sharma, and I was thankful from my core of my heart to him because it happened for us, which we never thought of. Never ever lose hope because there will be a one day for you, for your child. Miracles do happen.
Good evening, my dear friends. At the outset, I'd like to thank Anamika for sharing her personal journey. It's not easy at all. It's not easy for any parent to stand in an audience and to share a journey that is so personal, so intimate, and so important. So I just want to thank you, Anamika, for doing that. And I'd also like to thank Apurva Dubeji, two parents who have helped organize this conference. Both of them had their children take treatment from us. And inside, what they want is that what benefits they derived from the treatment for their children, that information is available to all of you. I once again want to thank all of you for coming here. Some of you have come here with your children, some have left children at home. So I, of course, come to you from India, to your wonderful country, and historically we've had great connections. A whole lot of doctors in the United States of Indian origin. I don't think you can go to any American hospital and not meet an Indian doctor. Is that possible? No. So we have historic ties. At the beginning of any lecture, I share this disclaimer that this talk is for information purposes only. This is not a substitute for a medical consultation, for which you should consult your regular doctor. And each child is different. So each child's needs are different, severity is different, and the treatments they require are also different. And whatever clinical results I share here have been published in peer-reviewed journals. This is very important because how do you know what I'm sharing is true or not? Today anybody can make up anything. But when something is published in a scientific journal, it goes through a peer review process. So the editor, editorial board, and 3 independent reviewers verify the authenticity. So as a policy, I only share data which has been peer reviewed, means somebody has verified his authenticity. That's the only data I'll share. So why are we all here? We're all here because we have these wonderful, lovely children, but these are children who have special needs. They have certain limitations. There are some things that they cannot do that neurotypical people like us can do, and because of which they become dependent on activities of daily living, dependent on various aspects of communication and education. And I believe, and you all know this from your own personal experiences, there can be nothing so emotionally shattering as to have a child have any problem. But when the problem is a medical problem, a neurological problem, it makes things worse. But what makes it even more severe is when you're told by multiple doctors, like what Anamika shared, that nothing can be done. And in your mind, I'm sure you must be wondering, we are planning to send people to Mars, there is so much science, tech, there is AI all over the place, then why can't my child be helped? What is the use of all this technology and AI if our lovely children can't be helped? And so we are here. That is what has got you here. So I'll divide my presentation into 4 parts. First, I'm going to share a major shift which has occurred in just the last 3 months, particularly in America. How the top leadership and the world's most influential people are now talking about autism. You may have seen these videos, but I just want to share it. So there is a shift in the wind. Earlier, nobody spoke about autism. And now you will see the people who are talking about autism. So we are going to talk about shifting minds. Then we are going to talk a little bit about autism per se. And then we are going to see what is new in the understanding, what is new in the science and research. And this is all our own original research. And then, of course, what is new in the treatment or management. So the first thing is autism awareness. And there is a shift because people who would not speak about autism earlier are now speaking about autism, and we have shifted to understanding rather than focusing on the deficits. So suddenly there is light. I've been in this field for several years, 30 years of being in this field, 20 years in regenerative medicine, and what has happened in the last 3 months hasn't happened in the last 20 years, and you'll see why. We're going to see the 2 most powerful leaders in America talk about autism, and we're going to see 2 of the richest men talk about autism.
Our goal is to get toxins out of our environment, poisons out of our food supply, and keep our children healthy and strong. As an example, not long ago, and you can't even believe these numbers, 1 in 10,000 children had autism, 1 in 10,000. And now it's 1 in 36. There's something wrong. 1 in 36. Think of that. So we're going to find out what it is.
So that's the President of the United States talking about autism.
In my age group, 69 years old, the autism rates in my age group are 1 in 10,000. Still. In my children's age group, it's 1 in 34, 1 in 22 boys.
Isn't that because it comes with a shorter life expectancy?
No, autism does not have a shorter life expectancy. People with autism can live as long as anybody.
So that is RFK Jr., who's now the health secretary, and he's talking about autism.
You've talked about that if you were a kid today, you would probably have a diagnosis of autism. What makes you think that?
Well, the term, particularly when they say on the spectrum, that's gone from being a very narrow thing to now pretty broad. And I was very slow to develop socially. I kind of rock. I concentrate intensely. My teachers were so confused that in the same grade they said put him ahead 1 or 2 grades, and another teacher said push him back 1 or 2 grades. So that was a dilemma. My energy, my obsessions, fortunately writing software being one of those, so that worked out well for me, marked me out as a very different kid in terms of my neurological style.
Your ability to focus as a kid and solve problems in your head, I mean, that you write about, it became kind of a superpower.
Absolutely. I wouldn't trade it despite the other limitations that it came with.
I'm actually making history tonight as the first person with Asperger's to host SNL. Or at least the first to admit it. So I won't make a lot of eye contact with the cast tonight.
Whether, how you think of Asperger's, like whether you can give us any sense of, even you as a boy, what the experience was, or as you now understand with the benefit of hindsight. Can you talk about that a bit?
Well, I think everyone's experience is going to be somewhat different. But I guess for me, the social cues were not intuitive. So I was just very bookish, and I didn't understand these I guess others could sort of intuitively understand what was meant by something. I would just tend to take things very literally as just like the words as spoken were exactly what they meant. But then that turned out to be wrong. You can't. They're not simply saying exactly what they mean. There's all sorts of other things that are meant. It took me a while to figure that out.
So why did I share these videos? That today there is light on the subject. When the President of the United States, when the Health Secretary of the United States, when the two, they are talking about this subject, when two of the richest men on the planet are talking about, their autism, now there is light on the subject. Earlier, autism was something nobody spoke about. Very often when you were given their diagnosis, you had not even heard the name autism. Am I correct? Very often parents heard it for the first time. You hear the word, you hear it when your child is given that diagnosis. So that is what is changing. That is what is changing. And there's a reason why I've shared this, because our own research is showing what is extraordinary in these children. Our PET scans are showing what parts of their brain are working more. So far, in the field of autism, we looked at what the children can't do. What our research is showing is what extraordinary things they can do. We've seen what Elon Musk has accomplished. We've seen what Bill Gates has accomplished. And it's time we focused our attention not on the half empty bottle, but on the half full bottle. This is very, very important as we go along. This is a major shift. It's a paradigm shift in this world. Earlier we believed it, but now our own research is showing this. Our children are not less than. They are different. This is so important for all of us to know. And that maybe they are capable of much more than we believe they are, and maybe we haven't heard how to listen. All right. What Anamika shared and what you saw in this is more important than anything else I'll share about later. If you can just go home with that take-home message, believe me, your children's life will change. The rest of the stuff is science, technology, information. It's useful, but this, according to me, is more useful. Now the next part of my talk will be about autism. So we know that autism is a neurodevelopmental disorder. It was first described in 1943. Typically is diagnosed in the first 3 years of life. We now refer to as a spectrum disorder, and boys have it 4 times more than girls. So there are multiple facets in autism. Of course, there are communication issues, there are repetitive behaviors, there are social limitations. But what is interesting, and this is what Donald Trump is speaking about, in his talk he says in 1970 it was 1 in 10,000, right? And now you can see, now this graph is from the US CDC. Look at how the increase is happening. Just look at that increase. This is the US government figures, not our figures. It was 1 in 44 2 years ago. In that movie, which was there earlier, it was 1 in 68, and you can see how it has developed from there. At this rate, if this goes up in the next year, it will be somewhere 1 in 20 something, then 1 in 10, and 1 in 5. And then what? It's time we did something. It's time we realized what is happening. Nobody's understanding what is happening. I've seen this in my own career ever since we've been working. We have seen the tremendous increase. So the number is very high, which means by these numbers, there are 70 million children on the spectrum, children and adults, 70 million. That, by the way, is 1% of the world's population. So you are not alone, okay? Now the fundamental, one question I'm sure all of you ask yourself, why did my child have developed? Haven't you asked that question? Like, why us? Why me? What wrong have we done? And so the causes of autism are several. They are established causes and they are controversial causes. The established causes, of course, are genetic mutations, older parents, problems during pregnancy and birth. And the controversial causes are, of course, the vaccines, heavy metals, exposure to electromagnetic devices, etc. So there are two, there's genetic and there is environment. We have seen a lot of twins have autism, we have seen triplets have autism. In fact, just this week I've treated, I had 4 families of two children, twins in their having autism. So 4 families, in fact, we actually shot a question answer session with them. In 1 week, 4 families having 2 kids each. So we have seen genetic, but there are several environmental factors as well. I'll just briefly run through it. Some of the more important ones are problems during the birth process. So any infection during birth, any diabetes during birth, depression, all of these can predispose to autism. Now, there's a very interesting research that was done by a doctor from Hyderabad. He personally met me and showed me the data. He studied 3,000 mothers of children with autism and their psychological and emotional state during pregnancy, and compared the data to mothers of kids who did not have autism. He found 100% of the mothers had gone through severe emotional trauma, depression, anxiety, family pressures, social pressures, marital issues. In fact, a significant amount of them had contemplated suicide. That was the surprising finding. Not attempted, contemplated. I was seeing the data and it was shocking. So when we talk of maternal health, the emotional state of the mother during pregnancy is extremely important. That's just raw data. It's something nobody talks about. We focus on the physical health. We say have good food, have good diet. What about the mother's emotional state? And there's a direct connection, because what happens is if you're emotionally upset, when you're stressed, the body releases a hormone called adrenaline, and that hormone narrows the blood vessels because it increases the blood pressure. And when all the blood pressures are narrowed, possibly the blood vessels to your child in the womb, they could also be narrowed, and that could lead to these problems. So mother health, both physical and emotional, is very important. Older age of the father is increasingly being seen to be a cause. Of fathers at 40 plus have a 3.5 times greater incidence of autism as compared to fathers in their 20s. Then heavy metals, Anamika spoke about. This is a topic all by itself. There are several heavy metals from aluminium, silver, copper, all of these, mercury, that are known to cause damage in the brain. There is increasing work on the exposure to mobile phones during pregnancy, because you're aware mobile phones have a radiation for a short distance when the call comes. And if you're, if the mother is pregnant and the phone is in your hand, well, this distance is enough, and that radiation can possibly cause brain damage. Research has shown that what the radiation does, it damages something called the blood-brain barrier. So our brain is the only organ in the body that has a protection system like a security guard. What do I mean by that? Our liver, kidney, muscles, they have no protection. So whatever's in the blood goes into the muscle or the liver or the kidney. But nature has provided the brain with a security guard called the blood-brain barrier, which doesn't let unwanted things go into the brain. Now, when in radiation during pregnancy, the blood-brain barrier of the children can sometimes be damaged, which means not very nice things can also enter the child's brain. Now, this is the controversial part. This is extremely controversial, okay? But the present Health Secretary of the United States, RFK Jr., has been speaking about this, not now, but for the last 15 to 20 years, that vaccines could possibly have a role. What is my personal view? It's two things. We have seen, I have had not one or two, but hundreds of parents come and tell me our child was doing well, and then after the MMR vaccine, there was a regression. How many of you have seen a similar thing? All right, that's a lot of you. Okay, that is seriously a lot of you. And now what we don't know is whether it was the vaccine or whether it happens to be, because the time when we give the vaccine is also the time when the symptoms of autism develop. So the jury is still out on this. The medical world is completely divided. Obviously, there is, the pharma that manufactures these vaccines is a strong supporter of it. There are people who are opposed to it. I, of course, believe parents. So when parents say something, parents have no reason to tell us anything except the truth. So if you ask my advice, of course, what happens is that if you tell parents MMR vaccine causes autism, then they stop all vaccination. That is dangerous. Vaccinations are important. There are several diseases which we have eradicated because of vaccinations. So the one thing you should not do is stop all vaccinations. But I believe you should not do unnecessary vaccinations. Like booster doses and, this and that. And there are a whole lot of vaccines which are now which you are being sort of compelled to take. So don't take the unnecessary ones, but the essential ones you must take. So basically what happened was in 1998, Andrew Wakefield, he actually published a paper in the Lancet showing that the preservative in the MMR vaccine caused autism. This guy his life was taken away from him. He lost his job, he lost his degree, everything away was, except for, whatever, everything was taken away. And of course, after this, the paper was retracted, and then there were several other papers. There were almost 25 articles which showed that it does not cause, autism doesn't cause, the vaccines don't cause autism.
There have been, as I understand it, dozens of studies done all over the world that make it very clear that vaccines do not cause autism. Now, you just said, if I heard correctly, well, if the evidence is there. The evidence is there. That's it. Vaccines do not cause autism. Do you agree with that?
As I said, I'm not going to go into HHS with any preordained.
I asked you a simple question, Bobby. The studies all over the world say it does not. What do you think?
Senator, if you show me those studies, I will absolutely, as I promised to Chairman Cassidy, I will apologize.
That is a very troubling response because the studies are there. Your job was to have looked at those studies as an applicant for this job. All right.
I mean, that's the debate. Now, that's happening in America right now. All right. So again, environmental factors, family and patient-related factors. So what I'm now going to show you is a series of parents, like Anamika spoke, just some short videos of what happens to parents, when their child goes through what you're going through.
At around 1 year, she had speech, but at around 1.5, she went mute.
When she was 1.5 years old, she was not giving an eye contact, not mixing with the children, and not replying to her name. So that actually triggered something is wrong.
Shihan was not at all talking, it's just everything is sign.
His focus is very poor, but very focused.
My son was completely speechless.
Never seen you talk, then you regress.
If you cannot speak, it's not safe. Even if someone is bullying you, you cannot even say and ask for help.
Challenges were really in his ability to listen to longer instructions, his ability to sit, process that, even talk.
Some of the kids stick toes. I would see it with my girl.
Noticing more and more of abnormal symptoms, which was hard to digest.
Was not able to control himself in terms of toilets. He used to wear diapers. He wasn't able to, very picky eating.
Whenever you opened the door, we had the threat of he running away. So we had to keep him contained. So unpredictable behaviors.
He was running away. He wasn't sleeping. I would stand up the whole night holding him and he would cry if I put him down.
We took her to the pediatrician. Then we got a shock. Oh, there she is suffering from autism.
When I was told about the diagnosis, first I saw the end of me. I couldn't handle the end.
It's like we lost our son. He was here with us, right with us, and he is not even responding to his names.
Then what is the solution? You have to go to therapy and all.
We had several years of therapy. That did not change much for me for 8 years.
Therapies was not making any changes. Pediatricians and all say that, oh, nothing can be done.
When I saw Dr. Alok talk about the amazing results that he's seeing based on stem cell, I don't want to wait. My child is losing his time.
Now we'll hear these same parents afterwards, talking about what improvements they've seen in their child. So now what is the new understanding of autism? And it's important that all of you be in touch with what's going on. The first thing is that because the problem is Depending on which doctor you go to, everybody sees things from their point of view. A pediatric neurologist will see things from the brain point of view. A functional doctor will see things from the blood point of view and the gene point of view. Maybe a geneticist will see things from the gene. So we have to see everything from a 360 degree. This is important, and that's why I'm going to share this information. So this is what I'm going to share with you is original research that we have done at our institute. First, on neuroimaging findings. We have shown, and we have done in more than 5,000 children of autism, we have done brain scans, and I'm going to show you what kind of damage is seen in these children. We have done biochemical findings, and I'm going to share some of that with you. We've looked at the genes, and we've also looked at what is happening to the gut. So I'm going to share this data with you. Again, this is all our original work. So the first thing, as you can see here, this is a PET scan of the brain. Green is what is normal, yellow is brain working more, but whatever is blue, light blue, is damaged. So in more than 5,000 children, we have seen, in particular, the small part of the brain at the back, it's called the cerebellum, that is damaged in all these kids. It's blue. In normal kids, this, or in all of us, this should be green. So we are again the first. You'll be surprised. Nobody in the world had even looked at this. If you have a fracture of the leg, will a doctor not do an X-ray of your leg? If you have appendicitis or a gallstone, won't they do an ultrasound? But I'm sure for the majority of your children, nobody's even looked at their brain. They've not done MRI scans or PET scans when the scans clearly show what's damaged. So we've actually done that in 5,000 children, and we've published all of this. Now, we've identified which parts of the brain, these are technical terms, are working less. So these are all the different parts, in particular the cerebellum, which is the small brain, and parts in the medial temporal brain. But we also discovered something very exciting. We discovered which parts of the brain are working more. There are parts of the brain which work more than us. This is what results in somebody becoming a Bill Gates or a Elon Musk. Albert Einstein was believed to have autism. So did Leonardo da Vinci. Some of the greatest inventions of our planet have come from people who've been on the spectrum of who had ADHD, and that's because there is a part of their brain that's working more. And that is where the shift is happening. We are looking at what's working more, and all this is published. This is our paper. So we were the first to publish actually what are the changes in the brains of kids with autism. So what I'm sharing with you is published in a paper. What we found was something interesting. We found that the brain activity decreases with age. You know, this is our data. We saw that there is actually a decrease. So this is to show you normal children, neurotypical children, from 4-5 years onwards, their brain activity keeps on increasing. But in children with autism, it keeps on decreasing. That is the role of early intervention. So if you intervene early, you have to bridge a smaller gap. If you wait longer, you have to bridge a bigger gap. But there's something very interesting in this slide. Somebody tell me what's interesting in this slide. Something very fascinating here. What's the good news in this? Somebody. No, something else. There's some good news in this. Somebody has to tell me this. What's really interesting in this? They're starting higher. Yes, look at that. They start higher. The brain activity for kids with autism start higher and then go down as compared to neurotypical kids whose brain activity go up, which means if you intervene early, you could reverse this. And that is what leads to kids with exceptional abilities and talents. That's the good news. This is science. This is data. This is published in a paper by us. Then another study that we did, this is also our paper, we looked at MRI scans, and in the MRI, so our brain has got two halves, a right and a left, and there is a bridge that connects them. It's called the corpus callosum. And we found that in kids with autism, that bridge is smaller. Again, we are among the first to show it, that the two sides of the brain are not connected as well in kids with autism. That means their brains are working well, but they aren't connected, okay, as much as we should. So again, this is all science, this is all published. This is in a paper that we have published. So now we know that there is a part of their brain that's not working well, and obviously if there's something not working well, that needs to be fixed. All right. We can't say that nothing can be done when there is data that's showing there's a part of the brain that's not working. Now, for some biochemical findings, What we've, so there is some, our body consists of tissue, tissue consists of cells, and the battery of each cell is something called the mitochondria. Just like the battery of your mobile phone. You may have the best mobile phone, if it's discharged, it is meaningless. So we have been working a lot on mitochondrial function in kids with autism. We believe that we go to the cellular level and fix the problem. These kids can completely come out of what they're going through. So what we have found are some other interesting findings. This is a little technical but very important. So there is something called folic acid. You must have heard of it. It's one of the B complex vitamins. Now when we take it orally, it's in an inactive form and the body can't absorb it. To absorb it, it has to convert into something called L-methylfolate. So folic acid is how we take it. This is how the body absorbs it. Did you follow me? It's a little technical, so I'll take some time. In autism, this conversion doesn't happen because of a gene defect. Now, what we are finding, interestingly, is that mothers have higher levels of folic acid because during pregnancy we are given supplementation. Okay, now this supplementation is very important because it prevents certain neural tube defects. But we are finding that high levels of these may be the cause of what is called autoantibodies. So we are finding that we are giving it in this form, but the body is not able to use it because the gene that converts it is inactive in these kids in 80% of our children. 80%, that's a large number. So again, we have been looking at amino acids and neurotransmitters in the brain, where, from the brain fluid, and we found all these things. We found that the glutamate is increased, GABA, these are technical terms. There's something called serotonin, which is decreased in the brain but increased in the blood, and dopamine, norepinephrine, oxytocin, and these are the symptoms caused by all these decreases. So again, there's a lot of, this is all again data that we have studied. This is what we are doing. There are some genetic defects. So I told you that to convert folic acid to a usable folate, there's a gene called MTHFR gene. And what we are finding is that in 80% of our kids, this is inactive. So these are all the things, mutation in 80%. 8 out of 10 kids with autism have this defective gene, so their body is not able to absorb. See, this is one of the things that happens. We keep pushing our children with supplements and vitamins, blindly actually doing them damage, because if the body can't absorb folate, the levels of folic acid rise and cause damage. So this is the shift that's happening. Earlier we blindly, it was like a bucket thing. You just gave a whole ton load of supplements. What we are saying is, please evaluate. Maybe you're giving excess of something. Because the body, you keep giving this and the brain can't use it. So this is very, very important to understand. Nobody is doing this. Has any of you tested your MTHFR gene? Great, positive or deletion? Yeah, so you found. So if you test it, you can correct it. In most of it's not even tested. And then we keep giving supplements. Are you following what I'm saying? You're damaging the brain by thinking you're doing good because you're giving things that the body can't absorb. That's why I want to, I can't overemphasize this. We are finding high folic levels. We are finding elevated homocysteine levels. Elevated homocysteine levels happen in people who have a brain stroke. In people who have a cardiac stroke, they have elevated homocysteine levels, and our kids with autism, all of them have elevated homocysteine levels. That means their brains are like the brains of somebody who has a stroke. We found decreased vitamin D levels. Almost all our kids, over 90%, have low vitamin D levels. You know how vitamin D is made? It's made by exposure to the sun. All you need to do is be exposed to the sun if your skin and vitamin D is made, but all our children have low vitamin. These are simple, correctable things. Okay, now of course in America you don't have, maybe in some parts you don't have so much sun, but still, we need to expose our children to the sun. That makes natural vitamin D. If not, we need to supplement it. There's a hormone that's less and we are finding elevated levels. So this is all work in progress. We've also seen a big connection of the gut. Okay, so we've been studying this in some detail and we found that there is 70% of our kids with autism, 70% have serious gut problems. And this is what we have found. This is again our research. We have found that the E. coli bacteria very high levels in 47%. We have found fungal infections in 27%. So these are all the infections we found in the gut. And we found that just by correcting it, we are seeing major improvements in the behavior. We keep thinking behavioral issues are because of the brain. What we are finding is a lot of the behavioral issues are because of the gut. This is totally correctable, but you have to do it. There's something called a gut microbiome test. If you do it, you can identify the infection. Again, what is happening worldwide is we're just treating everything. What we do is we target. Is it a viral infection or a bacterial or parasitic, and then treat only that. The treatment today is getting personalized. This is called personalized medicine instead of just having one size fits all. So now we've looked at our new understanding, and now we will look at what is new in the management of autism. So what is new? Today, we can manage it by comprehensive rehab, cell therapy, and integrative therapies. Rehab you're all familiar with, but my focus is comprehensive, because almost all our kids don't get comprehensive. In some countries, they get more ABA. In some countries, they get more occupational therapy. In some countries, more speech therapy. What is needed is comprehensive. We'll talk about cell therapy, and we'll talk of something else called integrative therapy. So we're going to look at all of these together. So what is new now? There was an old thinking that once the brain is damaged, it can't be repaired. But the newer thinking is that it's possible to repair brain damage by cellular replacement and repair. So now we look at the main topic of today, which is stem cell therapy. There are different words. It's called regenerative medicine, stem cell, cellular therapy. Basically, it's all the same thing. Where does the word stem come from? The word stem comes from the stem of a plant, and just like the stem of a tree results in branches, leaves, flowers, and fruits, there are some cells from which all cells of the body can arise, and these are called stem cells. So what exactly is stem cell therapy? Basically, we are using healthy, good cells to repair damaged cells. That's all we are doing. Okay, so here you can see there is damage, that the blue is the damage. If you give stem cells, you can actually repair it. Now, I show this picture to show you this is a fracture. Can you see the fracture? All of you can see the fracture. And I ask you, if you had to have this fracture, would you do rehabilitation on a broken bone? Would you go to your physiotherapist and do exercises? Would any of you do exercises on a broken bone? I ask you. You'd get it fixed, right? You'd go to an orthopedic surgeon, they would fix it. But with our children, we are doing exactly the opposite. They have a major part of their brain that's not working, and we are forcing them to do things that their brain cannot do. No wonder they get hyperactive, irritable, because we are asking them to do something they cannot do. Their brain is not working. If the speech area is not working, this child will not speak no matter how much speech therapy you give. All right. So we, for the first time, have shown, but now, luckily, the good news is this is before and this is after our treatment, and you can see that brain has started recovering. All right. So now it's possible to recover, and so the same rehab you were doing earlier, the same rehab, when the brain is repaired, you will get better results. Much, much better results, because now you're doing rehab on a repaired brain rather than a damaged brain. I became a neurosurgeon in the 1990s, and at that time, if I needed to record a film, I needed a video camera. To take still pictures, I needed a still camera. We had computers that time to type email. For music, I used to listen to this. I needed a calendar. We had those telephones. We didn't have mobile phones. To calculate, I needed this. I watched television on this. I used a torch and a compass. And today, all of this is what? Is in your hand. Now, at that time, in 1992, when I became a neurosurgeon, somebody told me, one day, all of this will be in your hand. It was beyond science fiction. But it's happened. And the reason why I'm showing you this is exactly the same as happened in medicine. There were earlier other drugs to prevent cell death for neurogenesis, for trophic factors, these are medical terms. And today, all of these things are being done by one type of cell, which we refer to as stem cells. So what is the worldwide situation? You'll see, cell therapy is being used for neurological. There are over 290 papers for orthopedic, wound healing, cardiac, pulmonary, COVID, diabetes. So for all these conditions, these are the number of papers that have been used. In autism, you can see there are over 33 international papers, cerebral palsy 42, and these are the worldwide papers published. The Bible, Quran or Bhagavad Gita of medicine is a book called Harrison's Principles of Internal Medicine. This is a book that all of us read. It's like the standard book, and they have a section on regenerative medicine, and they talk of many neurological conditions which can be treated. The most prestigious award in the field of medicine is the Nobel Prize. You may have heard of it. And 3 times in a 15-year period, 1990, 2007, the Nobel Prize has gone to stem cell work. This is stem cells in bone marrow, embryonic stem cells, and reprogrammed stem cells. This is one of the greatest scientists in the world was Stephen Hawking, and he did a 10-part TV series on stem cells because he had a disease called ALS, or motor neuron disease, which was untreatable, of which we treat a lot. So how do these stem cells work? Basically, they have the ability to multiply, so a single stem cell can become many stem cells, but this is the most important part. They can convert into any cell type. So the same stem cell can become a nerve or a brain cell, it can become a heart cell, it can become muscle, it can become any cell. So that's the beauty. It can convert into anything depending on where you put it. So it multiplies and it converts. It also improves the blood supply to the brain called angiogenesis, and it releases certain positive factors that help in healing, because of which they repair, they regenerate and replace the damaged tissue. So that is just a little more technical picture showing, these are medical words: angiogenesis, paracrine, anti-apoptosis, neuroprotection, improved plasticity, endogenous stem cell stimulation, anti-inflammatory. These are technical terms, but this is how they work in autism spectrum disorder. Stem cells are of 2 types broadly. You can get them from your own body, from your own child, and put it back. This is called autologous, or you can get it from a donor. So very often this debate will be in your mind. You've heard of other places, other parts of the world, places that are closer to you where they do allogenic. So what's the difference between the two? In autologous, and I'll show you, we take from the body and put it back into the same body. Whereas allogenic, it is taken from somewhere else. The difference is, I ask you, would you take an orange and give your child fresh orange juice, or would you give a canned orange juice to your child? What would you prefer? Fresh, right? So what we're doing is fresh. We are taking from the child, putting it back into the child. Now, allogenic is like canned. It's like, what is the difference? Anything that is preserved has a preservative. Anything, all right? Also, they are cryo. Firstly, we take from the child, so we know the source. Allogenic, you don't know where they are from. They've been taken from anywhere. You don't know where they've been collected from, so the source is unknown. Second, they are cryo-frozen at -, several degrees. Ours is fresh temperature. Would you rather have food eaten fresh, or would you rather have food that's frozen in the refrigerator? Fresh, right? So we are doing fresh. Third, that is a preservative. We don't have a preservative at all. We have nothing. This is natural cells, all right? And most important, because it's natural and at regular temperature, we inject it into the spinal fluid, which goes directly to the brain. Whereas they have to inject it IV. When you inject IV, it goes from the blood vessel to the right side of the heart, then to the lungs, then to the left side, and then to the brain. And then in the brain, there is something called the blood-brain barrier, which may prevent them from going inside. So there is a huge difference between that and this. Ours is a technical process, requires a laboratory, we do it ourselves. Whereas umbilical cord cells, you just get it from a company and inject it. There's nothing to be done. So that is why we believe that autologous is better. Our results with autologous are much better. Stem cells can also be divided, as they can be from what are called embryonic stem cells. This is taken from spare IVF embryos or from aborted tissue. This is very controversial, and we don't use this at all. You can get it from the umbilical cord, where I discuss. What we do is from the bone marrow. These are called adult stem cells. We prefer this. And the last is iPSC, which is a combination. This is still in the research stage. So we do, whatever I talk about will be cells taken from the child's bone. So we prefer to use this because they are safe, they don't form tumors, there's no rejection, you can get them with a needle prick, no surgery is required, and there are no ethical issues. How do you inject the stem cells? We prefer to inject it through a simple needle into the lower back, and then the spinal fluid takes it to the brain. You can also give it IV, you can give it in the muscles, in the arteries, through the nose, and sometimes directly into the brain as well. We do intramuscular in a condition called muscular dystrophy, but we prefer not to use the other method. We use this method. So our procedure is very simple. It's 3 steps. First, we put a needle into the pelvic bone here. If all of you feel, you'll feel a bone over here. Why I'm asking you to feel? Because it's just below your skin, So if you put a needle, it goes directly, you can see the needle goes directly into the bone, and then we pull out the bone marrow. We take it to a laboratory where we filter it, separate the stem cells, and then with a thin needle, we inject it into the lower spinal fluid from which it goes to the brain. So let's see a video of that. See, this is the bone marrow. The child is sleeping and the bone marrow is coming out. We take it to a laboratory. We separate the stem cells, and then through a thin needle, we inject it into the lower back, and from there it goes up. I'll just show you this video again because this is important. A needle prick and bone marrow. It's like how you collect blood, but we collect it from the bone marrow. It's taken to the laboratory, stem cells separated, and through a very thin needle injected into the lower back. So basically there are 2 needle pricks only with our treatment. Just 2 needle pricks. There is no cutting, there is no stitching, there is no operation, there is no suturing, there is no intensive care, there are no lines, tubes, nothing. 2 needle pricks. That is all we do. And what are we putting in the child? The child's own cells. No artificial chemicals, agents, preservatives, nothing. This is the way the body was meant to heal, using our natural resources. So now I'll show you our own published clinical work. I said whatever data I'll share with you will be published. So whatever I show you now is our own published work. We published the world's first paper on cell therapy in autism. The second paper came from China, the third from Italy, fourth and fifth from the United States. We again published the 6th paper, Vietnam, Iran, and the 9th paper came from the United States. So this is the world's first paper. We published this in 2013. This was bone marrow mononuclear cells for autism, an open label proof of concept. It was a small study, 32 patients, and 91% of the patients showed an improvement. And they improved in all, you can see the percentage of symptoms from social aspects, emotional, speech, behavioral aspects, sensory aspects, hyperactivity, attention, eye contact. So you can see the percentage of improvements. Our next paper was in a very prestigious journal, the American Journal of Stem Cells. And this was a larger study which showed it as a novel therapeutic strategy. This was 254 patients, and we showed 95% of the patients showed an improvement. You can see here the percentage of symptoms. So this is the percentage of improvement in the symptoms: social interaction, eye contact, attention, stereotypical behavior, aggressiveness, hyperactivity, self-injurious behavior, sitting tolerance, command following, speech, and communication. So above you can see the percentage of improvements that were there. And now this was interesting. We found that the improvement decreased with age. So below 5 years, we had a 98.8% success rate. It became 95 between 5 to 10. It drops during puberty. So we found that during puberty, the results are a little less, between the 10 to 13 years. And then again, similar results above. So this is the reason for early intervention. This matches, in the graph that the brain development keeps on decreasing, that might explain this. Because when you treat here, the brain is still more better developed. When you treat here, maybe you're climbing a steeper hill because the brain is more damaged. So our results depend on age. We don't have a 100% success rate. There will be some patients who don't improve, but the percentage of patients who don't improve is more after 10. 10% of our patients don't improve who are above 10 years of age. Now, objective proof on PET scan. So here you can see, now this is on a Siemens machine. The PET scan is made by 2 companies, Siemens and General Electric. So Siemens pictures are like this. You can see the damage before, and 6 months afterwards, you can see this damage is gone. This damage is significantly reduced. So this is objective proof that the brain damage in kids with autism can be reversed. We don't have 1 or 2, we have 5,000 such PET scans. 5,000 that show before and after. I can only show you 1 or 2. And this is on a GE machine. The picture looks different. Again, you can see because the machine is different, the picture looks different. Here's the before, stem cells, no activity. And after stem cells, you can see significant improvement in the activity. This is objective proof that the brain function can improve. And this is our next paper. This is what is called preprint. It has been sent for publication. This is 1,000 patients. And here again, you can see the improvements in everything. Similarly, attention, command following, eye contact, sitting, social, hyperactivity, speech, stereotypical behavior, aggressiveness. You can see the percentage of improvement is significant. And these are the scores, the Indian score for autism, CAR score. You can see 85% improved on these scores. And these are again the symptoms which show that these are all statistically significant. And here again, there's an age decline. So we see, this is a larger data. So the figures are slightly different. Earlier was data of 250 patients. This is 1,000. So here we had a close to 90% between 0 to 5. And you can see again with age above 15, it drops. And these are again pictures before and after. Just now was our data, our published data. What I'm now going to show you is worldwide published data. So I'm separating the two. This is papers published all over the world. So this was our paper, of course. And so we showed a 91% success rate. The next paper was from China. And they showed 88% success rate. Then there was this paper from USA, from Dawson et al. And they showed a 90% success rate. The next paper from US again, from Kimberly et al. And they showed 90% success rate. This paper from Mexico, this showed a 95% success rate. This paper from Vietnam, which showed a 93% success rate. This paper from Italy, which showed a 78. The Italian paper showed the lowest results, about 78%. This is a systemic review. So what I showed you earlier was papers published on their own work. This is a collection. This is a systemic review is one when you take other people's data and put it together. So they studied 461 patients from 11 studies, and they found that it is safe and effective. In this other meta-analysis from China, they studied 325 patients, and they also felt it is safe and effective. So that was my this thing on stem cell therapy. Now, I'll briefly cover some other aspects. Neurorehab. Why is neurorehab important? The brain is like a computer, and a computer's got hardware and a computer's got software. Stem cell only fixes the hardware. The software comes from therapy. So therapies are very important. People think that once you do cell therapy, my child will improve. The child's hardware will improve. I can give you a complete assurance on that based on our clinical work. But unless you put software, you're not going to see results. So the stem cells repair the hardware, and rehab and teachings at home. We believe home is the best rehabilitation place on the planet. We don't give it importance. What we have found is our children have done very well. The parents work very aggressively, like we heard Anamika talk about the work that she's done. So the role of the parents is extremely important. We tend to depend on others, on therapists or others. We need to take charge ourselves. And this is what we have found. Parents who take charge themselves, who learn rehab techniques, who do it themselves, spend as much time as possible. The results are much better because the software is better. The hardware will improve, I assure you of that. I can't assure you the child will improve because this is not in our hands. So comprehensive rehab includes all of this. It includes speech and psychology and physiotherapy, occupational therapy, diet, nutrition, special ed. Unfortunately, our children don't get it all. It's like food. You can't just have proteins or you can't just have carbohydrates. You need a combination, right? So our children need a combination. And if you can't find it, find online sources and do it yourself. So I divide rehab into conventional, which is psychological, behavior, occupational, speech, and the newer ones, which is sensory integration and aquatic therapy. You all are familiar with ABA, so I won't go into details of that. That is ABA at our institute. There's occupational therapy, which has several subsects, and that is our occupational therapy at our institute. There is speech therapy. I won't go into details because you're familiar with this. Now, physiotherapy is important. Most people feel that for autism, you don't need physiotherapy. What we have found is our focus is so much on that they can't talk and their behavioral issues that we don't realize they have physical issues as well. They have problems with their tone. They have difficulty with walking. They have different weaknesses. And we found physiotherapy plays an important role in these kids as well because it helps avoid the clumsiness, tone issues, gait, postural instability. So physiotherapy is important. Art-based therapy is also very important. So we believe in a comprehensive rehab program like this. Please make this happen. If you don't make it happen, you will not get the best possible results. So we need to make it happen. If you can't get therapists, do it yourself at home. Now the newer things are sensory integration, and that's our SI room. It's a very important rehab because there are a lot of sensory issues, and aquatic therapy. We found aquatic therapy to be extremely important because it helps in all these things, from improving posture, sensory issues, social skills. We find that sleep patterns improve a lot, hyperactivity reduces. Aquatic therapy is not swimming. Aquatic therapy is therapy in water. It requires skilled therapists because doing therapy on land is simple. In the water, it's dangerous. Your child could go down. It could swallow water. So it requires very skilled therapists. And so we have a dedicated aquatic therapy unit at our place. And if you can get it, please do it. It helps significantly in the kids. So what rehab does is it promotes cell integration and survival. It improves the blood and oxygen supply, helps in connectivity, makes new neural pathways, reduces inflammation, releases growth factors. So rehabilitation is as important as the cell therapy. So now the last part of our work is integrative. I spoke of cell therapy and rehab. What is integrative? So these are various therapies. We've introduced all of these in the last 5 to 6 years. Earlier we were doing only cell therapy and rehab, and we were finding that improvements were taking a little longer time. Now by integrating integrative therapies, which are basically oxygen-based therapies like hyperbaric oxygen, ozone, gut cleansing and diet, acupressure, and micronutrient supplementation, our results are now better. So the focus I'll talk to you, the three main are hyperbaric, ozone and gut cleansing. So this is a hyperbaric chamber, as you can see, and a parent and a child can go in very comfortably. There's a TV screen where the best thing is to put on cartoons so the children really love it. And what it does is stimulates oxygenation, helps with the immunity, improves brain function, metabolism, increases energy levels, reduces fatigue. So there are a lot of pressures. How does it work? How does hyperbaric work? So that's the chamber, as you can see, with the mother, with the father and a child. So basically, this is our blood. Now, our blood has got liquid called plasma. It's got red cells and white cells. Right now, we are breathing oxygen at one pressure, at 1 atmosphere. At 1 atmosphere, only the red blood cells carry oxygen to the tissue. There is no oxygen in the liquid. There is no oxygen in the white cells. And in the red blood cells, it's the hemoglobin. You heard of hemoglobin? So only the hemoglobin carries oxygen. But when you give oxygen under pressure, the oxygen goes into the entire liquid. Now the entire liquid is full of oxygen. So it results in oxygenation of those parts of the body which otherwise wouldn't have been oxygenated. We are finding hyperbaric oxytherapy extremely useful as an adjuvant to our cell therapy. We found our results are better. So this is very important. Then we have ozone. What is ozone? Oxygen is O2, ozone is O3. It is like a superactivated oxygen is just 2, but this is 3. So it's got what we call a superactivated oxygen. This also helps in many ways by lowering inflammation, improving oxygenation, improving the immunity, improving gut health, etc. So how do you give it? We give it through the ear. We just put this thing in the ear and ozone goes through the ear. We give it through the rectum to improve the gut issues. And we do cupping. So we take ozone and we have found that this helps in the speech, ozone cupping. And we also believe the use of acupressure and deep tissue mobilization helps in various things. We also do a lot of gut detox. So we do a gut microbiome test. It's an elaborate test. We identify the pathogens in the gut and then we cleanse the gut by various antibiotics, infective agents, prebiotics, postbiotics, diet. So this is a very elaborate study. The gut microbiome report is a 25-page report, which in detail, it tells you what are the chemicals, neurotransmitters, what is wrong, because the gut is what removes everything. And whenever there's a problem in the body, from the gut, you can actually make out what is happening. So we have a very detailed report, and the management of this takes 3 months. 3 months. You have to first kill the bad infective, then put the good ones, and then promote. So this is a 3-month treatment. So there are a lot of benefits of the gut. We find that once the toxins are removed, it improves the nutrient absorption, enhances energy levels, reduces fatigue, improves the immunity. So this is now an integral part of our treatment protocol. Diet, you all know, gluten-free, casein-free, what foods to eat, what not to eat. There's a lot of work on various diets. In particular, there is a lot of interest nowadays on camel milk. And we found a lot of people from areas where they have fresh camel milk finding beneficial effects. These are foods to avoid: sugar, additives, pesticides, etc. And we all are familiar with a ketogenic diet, which is high fat, adequate protein, and low carbohydrate. We believe in micronutrient supplementation, so we try to identify these things which are missing and we try to replace some of these. And those where there's an MTHFR mutation, we have to use a combination of these things, including give methylfolate directly, what Anamika was talking about, glucosamine, and magnesium glutathione. So all of these are things that we correct. Like I said, it's a 360-degree approach. So what we have found is that ozone and HBOT work together, whereas ozone enhances the cell's oxygen utilization, hyperbarics ensures its delivery, and the anti-inflammatory effects also, they all complement each other. As you can see, the ozone and hyperbaric complement each other. And these are the benefits of both. So we believe in combining these. Now, we actually did a study where we had, out of 1,400 patients, 700 patients had taken only cell therapy and rehab. Another 700 had taken integrative therapy also. So I'll share the data. So the ones who took only cell therapy, 87% improved. The ones who took the integrative therapy as well, 91% improved. So it's a substantial, it's a 4 to 5% difference, which is a lot. So this is our own data. And this is the percentage of improvements, like social interaction. If it was 56% here, it was 63 there. So this is showing how the different symptoms, like speech, for example, with cell therapy only 53% improved, whereas with cell therapy and hyperbaric 59 improved. Now, as you can see in this, everything does not improve. All the kids don't improve in speech, 53% improve. All the kids don't improve in hyperactivity. So this is the data. All the children improve differentially, but when you combine with oxygen therapy, the results are better. And the scores also, you can see, only cell therapy 82, whereas with cell therapy and integrative it's 90%. And this is, this you want to understand, it's PET scan data, but even the PET scans showed that when you give hyperbaric and ozone, the results are better.
When we came here to NeuroGen, she was totally nonverbal. She had no speech. Immediately after the first shot of stem cell, that's when she started now having one word.
Less than 2 weeks from that, he was using single words like
C4.
magically the water came out from the mouth, mama came out from the mouth.
Therefore, I remember the first day she called me mom, I cried. I cried because it was so emotional.
Within about like 40 days, a remarkable improvement. Her eye contact is fabulous. She started sleeping on it. I knew that is wonderful.
Biggest game changer for Prithvi is his expressive language, his speech. He started speaking more. He even started telling us what's going on in school.
He's able to listen, and he's able to understand more, and he's able to learn new things.
So after stem cell, what I saw was he was able to read sentences in his mind.
He has improved his eye contact. If he wants water, if he can't reach, he'll come and ask, he wants water. We gained so much progress in less time.
She started responding to her name.
Is Diana big?
No.
Diana is up.
Yes, a big girl.
Then his writing has improved. He can read single word to sentences.
My girl finally she had speech. Please give me food. Can we go for a shopping?
Cranberry.
And orange.
Orange.
And mixed seafood.
Mixed fruit.
High five. Now he's able to put things in sentences. Let's put on our shoes. Let's go to the car. Let's go to the plane. Let's go home. You feel now, yes, you got your life back.
She improved her performance in the school. Her behavior has improved. Her understanding has improved.
There are certain things which I have never taught him. Huge improvement in academics, English language, Bengali, that's Bengali is his mother tongue, and also a little bit of Spanish. He can tell you the date 7th February 2030. What will be the day?
From special needs self-contained class into a gen ed class, he would come and say, I got 100 in math today. I was the only one who got 100 in math.
My child started showing this extraordinary education skills. He can do calculations, he can do square root, cube root. I have also tried a little bit of cos theta, tan theta, which is class 9, 10 level with the options, and he has also given that.
The boy who was not responding, even if you call his name at the beginning, he is now, when someone walks into the room, he spontaneously, automatically says hi. He is able to grab and tell you to read for him, and you sit down and listen and watches and you read together. And he reads after you, and he's able to write. His handwriting improved.
Now I'm not scared that he would take off and run away, because I think he goes out of the house and he knows what he wants to play. If they say it's dangerous, come back, he comes back. So that stress is reduced.
I taught him my phone number for emergency purpose. I also taught him the address. He is able to tell me full address, and he is able to write it down so that if anything happens, he is able to say my phone number.
He understands emotions. If you are happy, he's happy. If you get upset, he knows you are upset. I have seen a lot of huge differences. It's like giving a second life to a child by doing the stem cell.
She could do short call on her own, but long call with support. But after the second one, he is fully trained.
हर बार stem cells से improvement है, and the improvement are permanent.
We've seen like significant improvements, hitting all his goals, and in fact we are now like figuring out what are the new kinds of challenges we need to set for him.
There are children with a special need, so they come to us and speak to her how Saisha is doing such a good.
My child has got some ability to fall back on and to make that as his career or the reason why he is here in this world.
The stem cell is a hope for a parent. You might not see the results in the same day or the same minute, but you can see faster and much better results.
He has, the two big sisters are both of them public health nurses. My mom is a nurse, and we are a medical family. But we see and observe him every single day, and we ask ourselves, it's just a few more years, Abdul Hakim will be independent.
So these were the parents you saw earlier, the same parents who shared what they were going through with their child suffering, and now you can see how they improved. But these are all recent parents in the last 3 or 4 years. Now I'll share with you a short video of somebody I treated 8-9 years ago, a child from America. Father is a cardiologist, mother is a nurse. And let's see what's happened to this child over 10 years.
He was screaming, he was crying, I was trying to hold him, and we were like 45, 50 people on that bus. And so on the way back, this woman just let it go. Would you shut up? I felt like a bullet went through me. I just thought, wow. I was like, oh, and I just said, my son's autistic, he can't help it.
He would flap like that. He would walk on his tiptoes, look at the wall and be talking to the wall.
He started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards. We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings. Gradually seemed to improve overall. His mood, he was so much calmer. There weren't these horrible, horrific tantrums. They were decreasing, and when he would have a tantrum, I could talk him out of it. We could engage with him and we could problem solve. He was able to sit at the table with us. He was trying new and different foods, put the food in his own mouth and do it consistently. As a parent, it was very exciting.
This is the first time since his stem cell that he has gone to a regular school.
Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months. When we saw the PET scan images, the areas that were hypoactive or non-active were warm. There was activity there. That moment will always be, a memorable moment.
People say, oh, he's a different child now. He's a lot calmer. He's talking normally. He looks like he's grown up.
He'll say, Mom, I love you. And those words had never been out of his mouth before.
stem cell therapy offers the potential for a cure. It has been a game changer.
He went for a summer trip overseas. He's off the spectrum now, doing very well. So, what's the scientific basis of our work? So, all our work is published in peer-reviewed journals. We have over 100 scientific papers, 16 in autism, medical textbooks. When they write chapters on STEM, they invite us. So, we've written this chapter on stem cells in this book on autism, in this book on cerebral palsy, again, the chapters from us, in this book on physical disabilities. So many medical books have chapters written by us. We have published 18 books. All these books are available without any cost. You can download them from our website. We have treated over 15,000 patients from 103 countries. So this is our hospital. We have 2 hospital buildings dedicated to this work, both in Navi Mumbai, India. Very briefly, I'll look at cerebral palsy. In cerebral palsy, the brain is damaged, but the effect is more in the body than in the mind. And you can see the brain damage is also more severe as compared to autism. There are some medical and surgical treatments, but after cell therapy, you can see this is the damage before, and you can see afterwards, the damage has disappeared. And again, our work is published in scientific papers. This is our paper 184 patients, and you can see all these improvements in all these factors, 15 scientific papers, chapters in textbooks. This is a child from Kenya. You can see totally wheelchair bound, unable to use hands, legs at all. And you can see the improvement that, after stem cell, the child is able to use his hands, can remove, wear a shirt. All this was impossible. There was no use of hands. And he's doing fine motor activities. He can put a charger. And this was something very emotional for the mother. The fact that he could take out a bottle of water, open it and drink it himself. This only a mother can understand how important that was for a child who couldn't. And now, from being totally wheelchair bound, he's now walking with support. And the last part is intellectual disability, which is similar, the symptoms are slightly different. We have the world's first paper here again, 58 patients. Now, this was a control study. That means we have 2 groups, those that took cell therapy and rehab and those that took only rehab. So you can see the ones who took cell therapy and rehab, 55% improved in cognition. Those who took only rehab, 17. In memory, 88% after cell therapy and rehab, 12% with so you can see in everything. Problem solving, relationships, social inhibition, toilet training, command following. The blue is cell therapy and rehab, much more than only. So rehab does cause improvements, but cell therapy and rehab causes much more improvement. So this is referred to as a control study. And you can see the outcome measures as well. We have 5 papers. So one question in your mind would be safety. So we've not had any major adverse events. No child has deteriorated or had some irreversible complications. But there are some minor adverse events. 3% of the children who had epilepsy after our treatment, these are children with a history of epilepsy or abnormal EEG. 10% of the kids get a spinal headache, which lasts for just 2 or 3 days. It is within the hospital, it goes away. Some children will have nausea, vomiting, local pain, etc. Most people only publish their good results. We've published our adverse events as well. So this is a scientific paper which says seizures as an adverse event of cellular therapy. So we've been very transparent about our adverse events. We published them for the whole world to see that this can happen. It is something that we have to accept. It's a small risk, but it is there. Just to let you know about the ethical aspect of the work, all our work is done with permission from our Health Ministry registered Institutional Ethics Committee. In America, they call it Institutional Review Board, IRB. We call it Ethics Committee. So my conclusions are that management of autism is multidisciplinary. We are going to need a whole lot of things together. Cell therapy is not just one thing. We need to combine everything. And newer imaging is giving us a lot of information. New biochemical investigations are giving us a better understanding. And many of these things can be corrected even right now. Even without cell therapy, you can correct the low vitamin D levels, you can correct the folate deficits, and new comprehensive multidisciplinary management. So cell therapy, neuro rehab and integrative therapy together will help, and these are safe and effective treatments. To be noted is that cell therapy is not a cure for ASD or CP. We are not curing it. We are improving the quality of their lives. And that this has to be combined with conventional and comprehensive rehab. It's not a standard of care, but it is considered to be a clinical option. So again, I'm saying this again, what we need is, we need to look at their brains, we need to do conventional and special rehab, cell therapy and oxygen-based integrative therapies. So we have discussed all these things in today's talk. Just a few things. What we have found is that the best results come with the following. One, it is very important to accept our child the way the child is. Like I said, we have to realize our child is not less than, our child is different. What do I mean by that? Suppose our child had a heart condition like a hole in the heart. You've heard of hole in the heart? Okay, some children have a hole in the heart with Down syndrome. Would you think there's a problem in your child? No. You think you have a normal child with a medical problem. But when our child has autism, we believe our child has a problem. Don't we? We feel there's something wrong in the child. That is what you have to correct. We have normal children who have only that part of their brain that is not working. If we fix that, they can lead close to independent lives. So acceptance is a must. Understanding of what is happening to the child. Please read. All information is now available on the internet. Now this we found very important. We found our best results come when the whole family works as a team. Everybody's role is very, very important. Earlier, in the first 7-8 years of our work, we always thought the mother's role is more important. In the last 4 or 5 years, we are finding that the father's role is extremely important, especially with boys. Because I ask all the gentlemen here, when you were small, who did you look up for behavior? Your father, right? You wanted to be like your father. You were scared of your father. You listened to him. Yes or no? Our special needs kids also do that. They look up to you for behavior. Look at your son. Just look. He'll be walking like you. He'll try to dress like you. He wants to be like you. But if you're disappointed inside with, what is happening, they also feel the hurt and the pain, but they can't process it. So it's very important to accept them the way they are. And we found our best results have come in those children where the father spent 2 to 3 hours every day with the child. And this information, what I'm telling you, we've learned from parents. What a father can teach the child in 1 hour, the mother takes 4 hours to teach. Not because the mother is a bad teacher, but because the boys listen to the father more. With mothers, you can navigate around. Mothers are for love, food, affection, all of that. Except some mothers. We have some mothers who are like really tough and strong, but the majority of the times, boys know how to navigate moms through emotion. Fathers, you can't mess with, right? So this is not information from us. Parents have told us. And this is multiple, not 1 or 2. We've had many, many parents tell us the same thing. So in other words, if you spend 1 hour to the fathers, if you spend 1 hour with your child, you are saving your wife 4 hours. If you spend 10 hours, you are saving your wife 40 hours. If you are head of a company and you had to choose somebody who did a job in 1 hour and somebody who did the same job in 4 hours, who would you choose? So it's very important. You need to take, and this is something we found. We've been looking at this data, and when we are studying our data of our kids who've done exceptionally well, whose speech has come back, who are in the normal education system, we found the father was playing a proactive role. The whole family has to work as a team, but a team needs a captain, and everybody has a role to play. In a football team, if you had 10 best forwards and not a good goalkeeper, would that team win the football match? Or if in cricket you had the 10 best batsmen in one team, would that team win that match? No, you need a full team. So the mother has a role, the father has a role, the siblings have a role, the brothers and sisters have a role. And the most important role, according to Temple Grandin, we were in an interaction with her, she was saying the best rehabilitation therapists are grandmothers. She's saying get the grandmothers involved in rehab. If you don't have a grandmother, according to her, find a neighboring grandmother. She actually said that. She said get some neighbor's grandmother. You know why? Because grandmoms are patient. They don't get angry. You get upset. If your child does something, you get angry, you get upset. They are patient. Now what you have to understand, the fundamental problem in that small brain I told you that's not working, that brain is responsible for processing information. Like a computer has got input, it processes and there's an output, right? So our children with special needs on the spectrum, their processing is slower. So you have to be patient with them. You have to talk to them slowly, okay? I mean, if I tell you right now, my telephone number is +919820046663, do you remember it? But if I tell you my number is +9198200200, whatever, now you remember it, right? Our children with autism need to be spoken slowly. But we are so rushed for time in our work and everything that we don't do that. It's like your old parents, If your old parents are walking, can you walk fast? You have to walk slow with them, right? Can you walk at the same speed? You have to walk gently with them. With our kids, we have to be gentle, slow. Talk to them slowly, and you will see the most miraculous things happening because their processing is slow. If you tell them, go to the refrigerator, get a bottle of water, give it to that, they are lost. Because by the time you finish the first, you've gone to the second, they haven't processed. If you tell them, go to the refrigerator, get a bottle of water, give it to dad, now they will follow it. So slowly, in our rush for time, we don't give our children time. And that's why Temple says grandmoms, because they do it slowly. Okay. And she talks of involving the children, involve them in the work. For example, if your child is not eating well, make him cut the vegetables. Okay, involve them in the kitchen process, involve them in everything. When you involve them, you suddenly find everything is shifting. That's the software. So of course, one of the other things, the whole family needs to work as a team. The other thing we found is that kids whose day is completely scheduled, like everything, fixed time for lunch, fixed time for dinner, fixed time for television. What we find is we keep complaining our kids are digital. What some families do is they give a fixed time. Okay, 1 hour for TV, 6 to 7. Half an hour for mobile phone, this time to this time. Now something very exciting happens. This we learned from parents. We didn't know this. If you give your child a fixed time of digital, at the end of that time, they come and give it back to you. Let's say you say use the mobile from 6 to 7 every day. Okay, at 7 o'clock, they will come and give it to you. So instead of taking it from them, they come and give it to you. All right. So this is the shift that you need to bring about. This is when the whole family works together. So cell therapy, I spoke about comprehensive rehab. We need to correct this. This can be done right now, even in your homes, and integrative therapy. And there's some good news. The good news is that I was just there yesterday. I was in the Bahamas with a center that is setting up. We've finalized everything. The date for inauguration is 1st Jan 2026. So we are going to be very close to you soon, but it's going to take about a year till we get operational. It's going to be run by us. And I'd like to end with the views of the Prime Minister of India and the earlier President of the United States on stem cells. So this is a book that I've written, and I'm very honored that in a book that I've written, Honorable Prime Minister Sri Narendra Modi ji has written an introduction. Very few people that he will write an introduction for. So this is a book authored by me, and the Prime Minister has written an introduction. It's a book on muscular dystrophy, where I talk about stem cells. And this is myself presenting him a copy of that book. And he's a big believer in stem cells. And let's hear what he had to say about stem cells in the parliament.
मैं जापान गया तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है हम गए तो वहाँ गए उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें.
So that was the Prime Minister of India speaking in the Parliament about stem cells, and here is President Obama.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So with that, I'd like to thank you for your attention. I know it's been long. I just hope I was able to give you some clarity on the subject, both on what is happening to our kids and what we can do with them. All right, it's important that you understand. That's why it took long. These are very technical subjects. I've tried to simplify them as much as I could.